some of the problems that existed at the time and really still exist in the U.S. health system. So one of those problems is that there's a whole bunch of evidence and things that we know we should do, but they don't get done. And I'm sure you guys have the same experience, but there was an article that was written in the New England Journal of Medicine, one of the big journals in the United States, back in 2003. And a woman by the name of Beth McGlynn wrote the article. It was very simple what she did. She looked at all these lists of things that should be done on patients mostly in primary care physician's office. So women ought to have mammograms, and women should have pap smears, and people should have their vaccinations, and we ought to ask everybody when they come in whether they're depressed, and we should screen people to see if they have too much alcohol consumption. There was a list of probably 15, 20 things. And then she looked at the evidence, because a lot of that data is publicly reported in the United States of how often it happens. And lo and behold, basically it was a flip of a coin. So it only actually happens 50% of the time. So you think about that there's really good evidence. So we're not arguing about whether it should be done or shouldn't be done, but that care only gets done half of the time. And then you take a step back from a patient standpoint. Of course, this is, healthcare professionals talking, but you think if the patients realize that, gee, I only have a 50-50 chance of having the things that everybody says I should have done. It's a pretty embarrassing situation. So, that was one issue. The other issue I touched on a little bit yesterday was that in healthcare in the United States, we get paid by what we do. And the more that we do, many times the more we get paid. So the system's called a fee-for-service system, meaning basically you get paid for everything you do. It's like making widgets, if you will, in a factory. It doesn't matter whether what you do went wrong or if what you did wasn't the right thing. We talked yesterday about doing cardiac catheterizations on people that there's really good evidence that probably didn't need a cardiac catheterization. Well, in the United States system, at least part of it, it doesn't matter. You still get paid for it, and people end up doing things over and over again. And that's one of the reasons why the United States spends 17% of its gross domestic product on healthcare. There's a lot of waste and a lot of things that don't need done. So that was the other piece of the puzzle we were trying to attack with what we call ProvenCare. And the three things that made it good was at Geisinger, where I work, we have the hospitals are owned by Geisinger or run by Geisinger. The physicians, in many of them, work for Geisinger. And then the third piece that we had that made it easier for us to test this in the U.S. system was we had our own insurance company. So Geisinger has what's called Geisinger Health Plan, which is an insurance company that started back in the 1970s to just insure Geisinger employees, but now insures a whole bunch of other people. So we could get these three groups together. You had the people actually providing the care, and you had the people paying for the care in the insurance company, and try to come up with something innovative to attack this issue of why do we keep doing things that we're not necessarily supposed to do? Why are we getting paid for things that aren't of value? And can we come up with a way that we're going to provide the right care to people all the time, and that we're going to pay for that in a way that incents people to do it? So instead of being incented to just do the same thing over and over again, we're going to make the incentives or line the incentives up so that the person only gets paid if they do the right thing. And that's